The Thunder Bay District Health Unit issued a public advisory yesterday to tell people that COVID-19 variants of concern are on the rise in the region. The health unit says it has identified 25 COVID cases involving variants, although it points out that 21 of those cases were identified in just the past 2 weeks. The unit says the outbreak declared last week at Musselwhite Mine was confirmed to be a variant subtype with 10 cases in total, but the outbreak is now under control. However, several recent variant cases have also been associated with rail transportation workers. Dr. Janet DeMille, Medical Officer of Health for the Thunder Bay District Health Unit, joins us now with more details. Good morning.
Good morning, Mary Jean.
So why did the health unit decide it was time to issue this advisory specifically about the variants of concern?
It's really to let the public know that we are seeing more cases. As you note, we've had some sporadic cases in the past, actually, I think, over the last several months that really hadn't amounted to very much. But what we're seeing over the last 2 weeks was, getting more test results showing that the variant is present. And, of course, we have an outbreak that's contributing to that, but it's not, there's cases outside of that particular outbreak. So really letting people know the variants of concern are really driving the rise in cases that we've seen in other parts of Ontario and other parts of the country. We know variants of concern spread more easily. They're and quicker, and really wanted to sort of alert people to the fact that we're starting to see more of them here, and really encouraging people to maintain all of those precautions.
Now, how worrisome is it that nearly 85% of these variant cases in the Thunder Bay District have been identified in just the past 2 weeks?
Well, you know what? I think it is significant, but at the same time, one outbreak can sort of skew the numbers for a particular period of time, and that's what we're seeing, of course, with one outbreak that we have. But I've always I think that is probably our biggest risk here in the Thunder Bay District, that we will get individuals coming into this area or returning to this area from hotspots, from areas where there are more COVID-19 cases. They get exposed, they bring it here, and then it could spread here. So I think it's really, that's sort of a risk. That's what I'm nervous. When I've talked about that being in a boat on Lake Superior and the dark clouds are really, the variants and that risk.
And which variants are we seeing the most here?
So what the one that we're really seeing looks like it's the B117, which used to be called the UK variant. That's where it was first detected, and it is the one that's by far the most prominent here in Ontario. But that's not the only way. The screen just looks for the mutations, and then and we do know that there's a couple of cases that are associated with it appears to be another variant, and we don't know which one that is.
Okay, because I understand you are still waiting for more information on several tests to determine what variant is involved. Is that still?
Yes, and those tests actually can take a couple of weeks to come back to really confirm, and it's going to be, I think, prioritized for us, but I'm not sure when those results will come back. However, we're going to, they are variants, and we treat all of those the same way, really.
And how is this rise in variants affecting the response to these cases or to the situation in general?
So for the last couple of months, we've been working and applying public health guidance that was developed based on the variances. So it's sort of the provincial guidance. So we've already enhanced our practices around anybody who does have COVID-19 in terms of the follow-up, and we continue to do the same. And then when we know somebody is actually, like a particular case is screened positive, there's a bit more that we do in terms of the follow-up, just to ensure that, first of all, that individual, of course, is doing okay, but that we clearly sort of identify and manage any spread that may have occurred as a result of that.
Mm-hmm. Well, I mean, we've been seeing that, the tragic impact of these variants with the very large case numbers in southern Ontario. Our numbers have still been looking pretty good here. But what role do you think these variants could play in the trajectory that we have been on?
That's a really big uncertainty for me. I think, we obviously have a lot of measures in place, like right now, the full shutdown and the stay-at-home order. There's a lot of measures in place in the workplaces, the essential workplaces that are open, and that all, serves to protect us. But what we've seen in the past, right, from last year and all the waves that we've had is one event, one situation, one outbreak can really lead to significant spread in the community. And it feels like it's almost a bit of a roll of the dice sometimes, even though we have, of course, all of these measures in place. But so it remains. I mean, there are situations involving variants, and I know from my colleagues and others where, you could still control them with the measures that we have in place, and others where it does seem to get bigger and a little bit more out of control.
Mm-hmm. Now, speaking of essential workplaces, earlier this week, Health Unit launched a pre-registration survey to collect information from businesses and organizations whose staff are considered essential frontline workers. Why is that information important? Why are you getting that collected?
So this is really, essential workers who can't work from home are a key part of the Phase 2 rollout of the vaccination program, and we're definitely in the Phase 2. And there's a large group of essential workers sort of identified by the province that will become eligible for vaccination in this phase. And what we're looking for with that sort of pre-registration is we're looking for businesses or workplaces or organizations to identify themselves, and we want sort of the contact name and for contact information for an individual that we could work with to ensuring that the workers in that area can access immunizations. But we're also trying to get a sense of the numbers of essential workers in the different groups so that when we move through the priorities, and they're currently laid out as sort of priority one group and the second group, and that we have a sense of, how do we reach these individuals, so through that contact person, but also so that we have a sense of the numbers and we can allocate appropriate sort of clinic space in Thunder Bay that would either be with us or with a hospital clinic, or how we might be able to deliver clinics to ensure that people have access to immunization. So it does give us some a name and contact person as well as numbers to help us do the planning. And
so that information will actually, affect the vaccine rollout for those folks?
Yeah, like in terms of the timing, as we move through. So we know, for example, that childcare workers and education workers are in that first group, that group of priority, and we already do have the numbers of what that would entail. And that especially the education workers is a fairly big group, so we have to allocate a proper amount of time and vaccine and clinic space, obviously, to get groups like that done. And we're also looking at others. So we've talked about mines, for example, and they're part of that essential workers, obviously, who can't work from home, and so collecting those numbers just helps us do the planning.
Now, we've heard some stories, just anecdotally, of people who are lucking into vaccines, perhaps taking someone else to an appointment and being offered the vaccine themselves. What are clinics or pharmacies doing with vaccine that may be left at the end of the day or the week?
So if there's somebody who's attending to an appointment with somebody else and they're getting a vaccine, they must qualify through some mechanism anyway. We don't sort of do that randomly, I guess. But at the end, at the end of the day, though, we very carefully manage supply in terms of the vials of vaccine that we're using or that our partners are using in terms of how we distribute it. And then every clinic, including ours, needs to have a backup list so that if there is a vial that's open at the end of the day, we want to make sure that all of those vaccines get used, and we will call people in to the clinic who are on that backup list. And the backup list is usually members of the same priority group that's being immunized at that clinic, or a priority group that might be coming up in the next week in terms of for vaccination. And actually, we're working with our partners of generating one sort of backup list that all clinics can use.
And what about at pharmacies?
So I think pharmacies operate generally by appointments, and so they should set up the number of appointments that with the vials that they have and that they're prepared to use. And I don't know actually, but I suspect that they're directed to have some sort of backup list as well.
Okay, I was just wondering because, like I said, we have heard about people kind of lucking into vaccines, and when they were there I wondered if that was kind of an end of day. There's still some left in the vial situation.
It often is, and it often is like end of day, and we're certainly, and the province is very, very strong on ensuring that no vaccine is wasted, and so that there must be a plan in place to deal with those end of day doses.
Now, in general, we have been seeing our active case count decline. What's the realistic next goal in regard to COVID numbers in the next month?
It's really to hold the line and, on our COVID numbers here, and hopefully that we can control it, whether they're variants of concern or not, and minimize outbreaks, and certainly continuing immunization. There's also, we're starting to see the numbers drop across Ontario, which is very reassuring to see. And there is talk about, what does it look? Of course, I mean, we're all shut down, including schools, and there is sort of conversations happening around reopening and what does that look like and when is the appropriate time, and reviewing that color-coded framework, for example, updating that and making it, sort of relevant. I do anticipate that there will still be a regional aspect to reopening, and schools as well. Conversations and discussions about schools and looking at the evidence around schools and opening at times when we have like variants, for example, and what can that look like and what needs to be in place.
So you do have a sense from the province that we may be going back to those color-coded levels?
Yes, that's what they've always said in terms of when the shutdown ends or when it's ended, that there would and we would anticipate some sort of regional approach and a gradual reopening as the framework leads to, and I think I'm not totally sure exactly what's in the cards in terms of any updates, but certainly starting to hear those discussions happening.
Listen, as always, thank you so much for taking some time to speak with us this morning.
Thank you very much, Mary Jane.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.